Welcome to the Taylor Method for Pain-Free Living, a podcast that features enlightening conversations with experts in the medical field that helps to improve the health and well-being of those suffering from chronic pain due to injury. Learn from leading authorities the questions you should be asking to experience pain-free living. Hosted by father and son, Dr. Derek Taylor and Dr. Hudson Taylor, and joined by industry professionals in the health field, including doctors of integrative medicine and personal injury attorneys. Enjoy well-rounded and informative conversations to help you get out of pain while achieving optimal wellness. Dr. Derek Taylor and Dr. Hudson Taylor are the doctors of Taylor Chiropractic and Laser Center in Florida and California. Both father and son duo have earned respect and a solid reputation for successfully helping people transform their lives by assisting them to discover the hidden causes of their painful health challenges, leading them to experience the resolution of their problems using the Taylor Method. Tune in each week to learn about the Taylor Method, Dr. Taylor's proprietary technology that looks at the whole person and identifies the root cause of pain while facilitating natural healing and helps to restore the body to optimal wellness without using drug injections or surgery.
Well, welcome to the show. This is Dr. Derek Taylor. I'm here with my guest, Bryan Anderson, who is the Director of Sports Medicine and Community Outreach for Cora Health Physical Therapy. Met Bryan at a World Pickleball Open event. And you have a ton of experience with pickleball injuries, and that's kind of what we're going to focus on in today's show. Bryan, welcome to the show.
Thank you so much. Happy to be here.
Yeah. So you've been dealing with pickleball injuries now for quite some time. I mean, you guys do a lot of the pickleball events and tournaments all over Florida, correct? And beyond?
Well,
is that beyond that?
Yeah, actually, and beyond. We have a great pickleball history. Cora does. We got started probably about 5 years ago, covering the U.S. Open in Naples, and just kind of springboarded from there. So we still cover the U.S. Open. We do a lot of local tournaments, but we're also the official sports medicine and physical therapy provider for the APP National Tour. So we have staff that cover and basically all tour stops in the lower 48 states.
Great. And so what are some of the most common pickleball injuries that you are treating there at your clinic and at these tournaments?
It's interesting. Pickleball is an interesting sport. So we get a lot of the traditional paddle or racket sport injuries, but a little bit of a different focus or nuance. If you're familiar with the sport at all, it's really fast paced, but in I would say a smaller geographical area, right? So a lot of very fast twitch motions, a lot of very quick responses, I would say. So we see, chronically, we see same things that hard court sports will see. We'll see plantar fasciitis, Achilles tendonitis. We see a lot of shoulder and elbow type stuff. We see a lot of tennis elbow type stuff. Acutely, we'll see, ankle sprains. We'll see knee sprains and ligament tears and even tendon tears at times. What makes pickleball interesting is it's really one of those sports that you got to look at, especially for our chronic type injuries. We look at it and kind of teach looking up and down the kinetic chain. Right. So again, if there's something going on with their Achilles or their plantar fascia, a lot of times it goes up the chain, and it's really because they're missing a lot of motion in their hip or their knee or something. So they're adapting at that Achilles, which makes, for a clinician, really interesting. Right. You get to look at it kind of a puzzle and really dig in and help people.
Mm-hmm. Yeah. And a lot of these kinetic chain issues are you have a lot of these dysfunctions in joints that are not working properly because those are areas that have been previously injured before and they've never had it addressed properly, right?
Absolutely. Mm-hmm.
So they have embedded scar tissue in those joint capsules and the muscles and the surrounding, and so it's not working properly and it's setting them up for more injuries.
Absolutely, yeah. And I would say most of it's coming from core, so hip, low back, either being not strong enough in the core, not mobile enough in the core, or not, that always translates force up and down, right? Or over force. And you're right. So we end up getting these patterns of immobility that, again, just translate on up and down that chain. And you see a lot of these adhesions and movement disruptions, I would say, that may manifest in a lower extremity injury, but again, is coming from, hip, thigh, low back, which makes sense, right? If you're having to reach for a ball and your knee doesn't bend well enough to get there, or your back's not mobile enough, or your hips aren't mobile enough, all of that motion for you to get to that ball is coming from somewhere else, right? That maybe not, made or designed well enough to attenuate that force.
So what advice would you give our listeners, our pickleball listeners that are, they're not a world-class athlete. They're just going out there 3 times a week just to get some exercise and socialize and have fun and connect. And it's a great hobby for them.
Absolutely.
They want to avoid injury. They don't have any injuries right now. What would you recommend that they do to prevent having them altogether?
And so what I talk all the time about potential players and players now, and this is not even, we talk to professional players about this all the time, is you want to do more than just show up and play, right? So there needs to be a structure based around your play. Prevention is obviously number one, right? If we can prevent an injury, we always want to do it.
Sure.
It's better to be preventative than reactionary to injuries.
Sure.
So what we talk about is getting in with somebody, obviously Cora is modeled to do this, but getting in with somebody that understands the sport and the stresses of the sport and basically looks at that movement and your movement patterns. There's a couple different ways to do that. I know FMS is a big one, SFMA are a couple big ones, but really somebody just knows, hey, this joint's supposed to move like this in this setting, or must move like this in this setting, and it's not doing that. So in order to prevent injury, we need to work on that joint moving correctly. Or this muscle's really weak, should be stronger, so you're getting overpowered by this. Again, an expert that can tell you that, and that's really the number one. And then behind that, we talk about recovery, so making sure you're warm up and recovery, so making sure you're ready to play, but also taking care of yourself after you play.
Yeah, so you're talking about warm-ups before you play. It's important that they're doing proper mechanics while they're playing, and then after they play as well, just like a post type of stretching or routine that's going to help them after they're done with their play.
Absolutely. Yeah. And we always talk about a stretching program following some type of movement, right? So what I tell people is static stretching does very little for you before an event. So again, it makes you feel a little good. You feel a little looser, but as far as preventing injury, it does very little for you, right? So we talk about some type of dynamic movement, incorporating some functional mobilities type stuff, or stretching, right? So again, you see a lot of these players doing a lot of these they look either cool or silly, depending on how you look at it. These leg swings and all these different movements to get your hips opened up and get loosened. That's what we're talking about for a type of warm up. So again, something that gets that blood flowing, get those muscles used to moving, get those, the patterns that you're going to use them in. And then you go play and you take care of yourself while you play, obviously. But when you're done, we want to do some type of cool down, whether it's a lesser cardiovascular or functional movement type deal. Now is a good time to incorporate some of those static type stretches that we can get some plastic changes and some flexibility increases.
Yeah. What are some of the, can you make a recommendation for because a lot of these guys, they just want to jump, they want to go right on the court. They just want to start playing, right?
Absolutely.
You can tell your patients ideally, okay, this is what you need to do, but the compliance on that, may not be so great. So can you give us, our listeners, maybe a 5-minute or less routine before they play that would be, kind of cover the bases in general, and would be something that's better than nothing that you can recommend just off the top of your head?
Absolutely. And real quick, how I would start it is, again, some type of functional type movement. So again, whether that's hips, shoulders, whatever it is, just kind of moving around, getting things loose a little bit. And then what I tell people is do something a little bit sport specific. If you have access to a court, get around and do a little hitting, do a little jogging, do a little, and then implement your type flexibility type stuff, right?
Yeah.
And again, it doesn't take much. I'm with you, 10 or 15 minutes of good warm up, right? Get the blood flowing. The caveat to that is not to do too much, right? So in other words, otherwise you're defeating the purpose, right?
Yeah.
You're just stepping out and doing a bunch of vigorous exercises. So what I say is start kind of small. Again, it may be standing on the court side, moving your shoulders around, getting loosened up, again, doing some squats, doing some high knees, doing some stuff that's, again, just kind of telling your body, hey, I'm getting ready to exercise. And then you gradually increase, and you may go, start with just hitting back and forth with a partner, right? Or against the wall. I've seen a lot of really cool things that you can warm yourself up with in the pickleball world. And then maybe playing a couple points at half speed, chasing a couple balls down, making some reactions, making some, and then, hey, I feel loose, it's time to play.
Right. Okay. Yeah. Even like something like jogging around the court like 2 or 3 times, and then
Absolutely.
just getting maybe some shoulder reverse circles and some barn doors, and maybe
Absolutely
with the hips, just some big motions like that, just global motions, just to get things loose, get the blood flowing in there, hitting some at half speed, and then you're kind of ready to rock and roll. But the problem with pickleball that I've seen is that you don't have to. I mean, it's a strength, but it's also a weakness in regards to injuries. You don't have to be like, it doesn't take you years to learn how to play pickleball. You can pick it up pretty quickly, and it's a great sport for everybody in that regard. But then when that happens, you have people that are deconditioned, they're not ready, they jump right onto the court, and then they set themselves up for an injury, and so just getting the habit of somehow doing a warm-up like that is really good. Now let's talk about a post cool down type of routine. What would you recommend when they're done with their pickleball? Can you think of like a 3 to 5 minute?
Yeah, so I would say, again, kind of off the top of my head, I would say kind of doing something similar in reverse minus the cardio, right? So you get done, the last thing you want to do is just go sit down, right? So you get off the court and you maybe, again, just kind of move around, kind of doing an inventory. Okay, everything feels good. Maybe then grab a cool spot and a spot to lay down and grab, again, this is where something like a static hamstring stretch actually makes some sense, right? So your body's adapted to the exercise, it's ready to go. Maybe sit down and grab some calf stretches and hamstring stretches and quad stretches, and again, a nice cool place. You're recovering, with your fluids, you're recovering with some vitamins and minerals and stuff, as well as some calories that you just burned. Getting your protein back in there, so you're setting your body up to be ready to exercise again, whether that's 10 minutes later or an hour later or the next day. And that's really the issue we run into, that we end up counseling a lot on, is we have a lot of the plays in tournament style play, right? And depending on how big and how many people are in your pool in a tournament, you may play and have 10 minutes till you play again, or you may have an hour and a half.
Right.
So we talk a lot about, okay, so you got an hour and a half. You need to relax and cool down a little bit, but you don't want to completely cool down. You want to stay and give yourself enough time to get ready to play again.
Right. And tell our listeners why that's important to do that post stretching physiologically, just as far as the mechanisms. Why is it important for them to do that? You convince them. Some people say, hey, I don't have time to do that. I just got to get in my car and just roll after the game. Tell them how that's going to benefit them if they do something like that.
So again, we're really talking about injury prevention. So what we see is most of your flexibility gains are done in a flexibility routine post exercise or post dynamic, right? So again, you're really going to work on preventing that stuff. And besides, anecdotally, if you do moderate to severe or moderate, exercise, and then you just go sit down, you tend to kind of, we've all done this, right? You go for a run or you go for a big workout, and you get in your car and you can barely stand up afterwards.
Right. Yeah.
So again, I think just that motion, it kind of directs your blood flow, kind of directs your body, like, okay, hey, I'm done with the severe stuff. Let's cool down a little bit. Let's relax, but I still need to be able to move. Right.
Yeah. So of all the injuries that you see with pickleball, do you see more upper extremity injuries more common, or do you feel like lower extremity injuries are more common with pickleball?
Again, anecdotally, I'd probably say lower extremity.
And would you say the knee more than the foot and ankle? Or would you
I
say
would
the
probably
foot and
say foot
ankle?
and ankle more.
Are you seeing a lot of the ankle sprains? So when you're doing your tournaments, you're seeing probably the most common injuries like an ankle sprain on the court?
Yeah, for an acute injury, I would say.
Yeah.
Ankle sprain mixed with some knee stuff in there.
And then plantar fasciitis for more chronic issues?
We see a lot of plantar fasciitis, Achilles tendonitis.
Okay, so tell our listeners, what's the common advice that you're giving your listeners and your patients to help prevent that altogether?
So again, I think the key is really knowing that movement pattern and having a good idea if there's any restrictions or any problems anywhere along the kinetic chain. And then really that good warm up and cool down, I think helps, is going to be the most help. Outside of that, knowing your foot type and wearing the proper shoes for not only for your feet, but for the court, so that you're sliding or not sliding correctly, right? As you make cuts on a court, can be vital. And then knowing that if you need any type of interjection, whether it be orthotics or, again, a different model or style of shoe to give you the support or the cushion that you need.
Right. What's the common mistake you see with the incorrect shoe wear for pickleball?
Generally, we see the people that, and I'm guilty of it myself to a degree. You buy shoes because either so and so wears them, one of the major pros, or you buy shoes that look really cool, and it turns out you're a big pronator and they don't give you any support, or you're a big supinator and they don't give you any cushion. That's probably the biggest mistake, I'd say. When you get into pros, sometimes you run into, well, I'm sponsored by this shoe brand, so I wear their shoes and they hurt my feet. So most shoe companies now are pretty adept at making various models to fit everybody. But again, you've got to, if you don't know, then my advice would be to seek out the advice of somebody that can tell you or direct you. Like, I don't know what shoe they offer for this, but go and tell them you need, increased cushion or better, heel control when you're looking at a shoe.
Yeah. Is there a particular brand name that you prefer?
Not really. And pickleball is exploding so fast right now. There's so many options that I was actually laughing with Brent, who's our athletic trainer that covers the APP. And I'm like, I had no idea they made shoes. And he was like, they probably just started. So I think there's a lot of new brands out there, and they could be very, very good.
I personally like New Balance just because you have the different width options. You got a B, D, 2E, 4E, and you have some people that are playing pickleball, they got a really wide foot. You try to fit them into a Nike that's more of a narrow shoe.
Absolutely.
You're going to definitely have some ankle issues here, problems. And so that's important. You bring up a good point. The shoe wear is extremely important. Now, what about knees? What exercises would you recommend that the patient would do to help kind of prevent a knee injury on the court? Because once their knee's gone, then they're done with pickleball, right? I mean, they're not. They need cuts and everything. So what would you recommend exercise-wise to help strengthen and prevent knee injuries on the pickleball court?
So, it kind of depends on the individual. Again, we want to look at where there's any deficits or any muscle imbalances. Generally, it's protecting that knee is all about those quads and hamstrings, all about those thigh muscles, right? As number one, right? And then we move up into the hips. So again, your quad muscle acts as kind of a shock absorber for your knee, right? So your ability to attenuate forces comes from your, but if you're all quads and no hamstring, then you're overpowering that hamstring and you're going to wind up with other issues. The other one we find almost all the time, and again, it talks to the kinetic chain, is these glute muscles, glute med, glute max, and your ability to derotate this knee and basically keep it from going in, from those valgus forces, increasing that medial knee stress, is huge. And I can't, every time I look at a knee in pickleball, it's one of the it's either the first or the second thing I look at. Make a quad for me. Let me see your quad tone, and then let me test these glutes out.
Yeah, that's brilliant, because a lot of people, I deal with as I interact with other practitioners, other chiropractors, medical doctors, and you bring in a really good point in that most people are not even looking at the glutes.
Yeah.
When it comes to that, the glutes have a huge impact on the knees. And if those aren't firing and working properly, it's embedded with scar tissue, you're going to have some knee issues. So I'm glad you brought that up. What's your favorite glute stretch that you like to do?
So I'm a big fan of, dynamically, I'm a big fan, for lack of a better term, like we call them windmills. So just a big kind of open chain, kind of swinging side to side. I like high knees type stuff. And then statically, again, I like just a cross stretch. So on your back, pulling across your stretch, pulling across your chest. As far as glute med activation, it's a tricky one, but my favorite one is actually, you actually stand against a wall, and then you're actually varus or pushing out against that wall, and you're actually doing little squats, and you're firing the opposite glute med.
Can you show us on the wall behind you a little bit?
I can try. I don't know how well this will translate, but I can try. Tell me, can you see me pretty good?
We can see you.
All right, so let me see here. Let me move a chair. Still see me?
Well, you see the upper half of you. I don't see
the
lower
Let me
half.
adjust. Sorry, the box that I'm looking at across the office. Okay, you can see that pretty well.
Yeah, that's good.
So you see me braced against the wall, okay?
Yeah.
So my left side's facing you. My right knee is actually pushing maybe 5, 10, 15 pounds of pressure this way against the wall.
Yeah.
And then I just hit little squats.
While you're pushing against the wall at the same
While
time.
I'm pushing against the wall.
Brilliant.
And if you understand the mechanism of what your glute med actually does, it makes perfect sense, right? So your glute med holds that opposite hip up.
Yes.
So if it's getting that pressure against it, it's now stabilizing that hip and thigh through that movement.
And how many reps and sets would you recommend our listeners do with that?
I start small. I mean, again, if you're weak like I am, if you're kind of fat and out of shape, and if I hit 10 of those, my glute med will be screaming at me. So I pick a normal progression. I tell them, hit 2 or 3 sets of 10 and work into it a little bit. And when they get easier, add an unstable surface, and we're adding some more core and stability to that type of stuff, or
I love it.
a band somewhere.
Yeah, that's great. Now we have a few more minutes left in our show. Let's talk a little bit about upper body here. What's your biggest issue that you see on the courts with upper extremity injuries that you commonly see, especially at these tournaments and whatnot? Is it more shoulder than elbow, would you say?
It depends on type of injury. So I would say chronically we see more elbow.
Okay.
I see more of the tendonitis type stuff, tennis elbow.
Yeah.
Fairly common. And again, it depends on your game and how much spin and backhand you're trying, or force you're trying to put on a ball. Acutely, I would say I probably see more shoulder.
Yeah.
Again, that follow through on a big hit and your rotator cuff trying to decelerate that upper extremity. We see a lot of rotator cuff type stuff. And then we see a ton chronically, just general upper extremity of postural control problems. So the nature of pickleball is that athletic stance, so you're down and people tend to get into that rounded shoulder type, and you're digging balls and stuff. So again, that's one of the things we talk about is loosening those pecs up, strengthening your retractors, keeping those shoulders in a good spot to make movement, to get rid of stress on your rotator cuff, but also, impingement type stuff.
What's one of your favorite upper extremity shoulder stretches that you like to do and recommend for your customers?
So again, I love dynamic type stuff. So I like you talked about, barn door type stuff. I like even windmill type stuff, just as kind of a warm up. As far as I'm a very dynamic or a very functional movement type guy, so I love some simple bands even. And then I like it's kind of an oldie but a goodie. I'll have them like stabilize on a med ball or something on the wall,
Mm-hmm.
and then do rhythmic stabs with them. So just
Yeah.
move the ball and just make them, protect that shoulder, make them stabilize.
Yeah. Good.
And anytime you can add that perturbation, right? So they have to stabilize that glenohumeral, and it just gives you a good postural place to be. Okay, shoulders back, chest out. Shoulder, you know what I mean? Again, keep that postural.
Right. And then for the elbow, any insights that you want to pass on to our listeners with all your years experience working with elbow problems?
So one of my best things is actually soft tissue. I use A-stem a lot for these type of injuries, and that's for lower extremity as well, to get that, restore that normal movement pattern, right? So again, I don't know that I have a favorite exercise, but something like a soft tissue intervention, even if it's just massage, right? Even if it's just hands, an A-stem, a Graston, a dry needling, something like that, even a massage gun, right? To get those fibers activated, a good static like mobility and stretching stuff. And then, again, some type of functional or dynamic warm up. And I tell people, to me, the best time to get these interventions is right before you play, right? So if we're doing a soft tissue, A-stem, Graston, dry needling, that type of thing, I want to treat you within 30 minutes of you stepping on a court, because I think that's when it'll be the most beneficial.
Yeah, I mean, getting that blood flow circulation there, loosening up those tissues there. I think that's a great proactive strategy. That forearm is just loaded with adhesive scar tissue. And people think about the forces that takes with, they're doing this. How many hits do they have in a match? That they're and this is taking up a lot of that force there. So I think what you said was like perfect in regards to the myofascial work in that area and breaking up that scar tissue. It really relieves a lot, not only for the elbow, but also for the wrist, and even has some benefit to the shoulder. It doesn't have to work quite as hard, right?
Oh my, absolutely. Yeah.
So anyway, well, this has been a fascinating show. I think if you're a pickleball listener, you have to listen to this show. I mean, it could save somebody a lot of heartache and headaches from, injuries that they could have easily prevented just by doing the things that you mentioned here and talked about in this show. So, Bryan, how can our listeners get a hold of you? What's the best way that they can reach your office, and if they want to do a consult with you, or do a kinetic chain evaluation that you guys offer? I mean, can you give us some information on that?
Yeah, the easiest way to contact us. So we have just about 250 clinics across 10 states. So coraphysicaltherapy.com, and they'll find that clinic closest to you. And every one of our clinics will offer, some type of functional evaluation. A lot of times, if you're having an issue, we'll do what we perform a complementary injury screen. So if you're having a problem, reach out to that closest clinic, and they'll look at it for free or for complimentary, and kind of tell you what you need to do.
What's involved in that complementary injury screen?
So essentially, they'll get a quick history, when did it start hurting, that type of stuff. And then they'll stress test it and ligament test it. And, the goal is to keep it somewhere 15, 20 minutes to determine next steps. So is this something that, again, as a referral to somebody like you, a chiropractor that can work on these things and functionally, or an orthopedic, or are you a good candidate for therapy? Or a lot of times it's, hey, you got tight hamstrings. So here's a dynamic stretch and work on this and let us know if you have any problems.
Yeah, that's great. I love it. And I've worked with you guys a few times there at the World Pickleball Open and then in the Pickleball Expo. You guys do great work. I mean, people who come to us, and I'll just send them over your way, and they're always pleased with the work that you guys do. And you guys are very generous with your time and your resources. So I really appreciate you guys and what you're doing there for the sports medicine world, and keep up the good work.
Well, thank you so much. Thanks for having me. This has been awesome.
Yeah, thanks again. And this has been with Bryan Anderson here with Core Health, Director of Sports Medicine and Community Outreach. If you just joining the call now, make sure to go back and listen to the whole thing. It's great insights and information on preventing pickleball injuries. Thanks again, Bryan, for being on our show, and we'll talk to you next time.
Perfect. Thanks for having me.
Thank you for listening to the Taylor Method for Pain-Free Living podcast. For more information about the Taylor Method and how you can find lasting pain relief, visit www.drderektaylor.com. That's www.drderektaylor.com.